Item 20, comprehensive approach to the opioid crisis and adoption of the San Diego County Opioid Settlement Framework. I really appreciate my colleague Supervisor Joel Anderson and his work in developing this, the actions taken. I know our district attorney is here. We will hear from shortly. I appreciate her involvement along with Under Sheriff Kelly Martinez, and appreciate all their support. The reality is across our country is America is in the grip of an opioid crisis. This is not unique to San Diego. Across all 50 states and all communities, folks are suffering from addiction, trying to stem the loss of life that have resulted from the year-over-year increase in opioid deaths. In 2021, nearly 1,000 San Diegans died from opioids. Every one of this was somebody's child, somebody's brother, somebody's cousin, our parents, our loved one. The year-over-year increase goes back more than a decade, but it has been particularly acute in the last few years. And the county, as an entity and as a board, I think we grasp the urgency of the situation and feel a great desire and need to move as quickly and fastly as we can to try and address this crisis. The County of San Diego has been involved in multiple lawsuits against many of those who profited off of and whose intentional actions created the situation we face today. Certainly the nature of addiction is not new, but the prevalence and intensity of the opioid crisis at its core was born out of greed. Individuals who saw a way to profit personally for themselves with what are reckless and irresponsible actions. The only recourse we had as a county was to join in the lawsuits against those who manufactured them, who developed them, who were dishonest about the nature of the addiction, who intentionally increased dosages, those involved in distributing them and putting them out. And the county is involved in a number of lawsuits across the board, and we estimate in the coming years we'll be the recipients of upwards of $100 million that will come into the county to help address or mitigate the very real impacts of what we face on the opioid crisis. In this situation, we have a couple of approaches we can take. We can wait for all the funds to arrive. Then we can spend a considerable amount of time about how we would invest those, and then we can spend additional considerable amount of time getting from decision on how to invest them to implementation. I believe today we are taking action in the right way, which is proactively, before we receive the funds, adopting a framework for how we will invest them, ensuring as a county internally that we can leverage future revenues that we are coming by making quick investments today to meet the need of that. And so to prepare for the use of these forums, Supervisor Anderson and I have spent the better part of 6 months convening leaders and stakeholders across multiple areas of opioid-related issues to really hear best practices, to hear ideas, to hear what's needed, how can we best make a positive difference in our community. We heard from families who were impacted by the crisis. We spent time with our medical community, our hospitals, our doctors, first responders, social justice advocates, drug treatment specialists, law enforcement, our district attorney, universities, researchers, and so many others. At each of the convenings, presentations were given by experts in the field of addressing opioids. I want to say a special thank you to representatives from Johns Hopkins School of Public Health, the White House Office of National Drug Control Policy, the National Association of Counties, the Corporation for Supportive Housing, and so many others who really came together to provide input, look at best practices, and shape our thinking. After listening to experts, to testimony, to small breakout groups that were held, community members were engaged on topics related to the presentations and really designed around how can we develop a framework that we think will have the greatest impact. Issues rose to the surface around healthcare integration, harm reduction, social supports. Participant comments were collected and have been key in shaping this policy. More than 200 stakeholders provided comments during and after the convenings, and I want to say a special thank you to everyone who participated in this effort for your feedback, your expertise, your passion, your commitment to doing everything that we can to save lives and make a positive difference. And so we are incredibly grateful for everyone who participated. The overarching report is included in the board letter, which includes detailed feedback received as a part of this effort. Although the pharmaceutical companies and prescribed pills were the catalyst to the tragedy, the crisis has really gone to a new level with the injection and presence of fentanyl, a new synthetic opioid, which is here in our community. Fentanyl is incredibly potent, and as much as we had a problem with opioids, the presence of this new synthetic opioid and fentanyl has really accelerated the damage that is being wreaked in our communities. We find fentanyl mixed in all classes of drugs, and this nightmare scenario is creating a whole new generation of people with opioid use disorders who may not have followed the traditional pathway to get there. We know out of folks who are on the street today, 86% of them who are suffering or using heroin begin by using a prescription opioid for a non-medical use, 86%. But now with the explosion of fentanyl, we're seeing people who didn't start that same way, adding to whatever underlying addiction they faced and compounding that with a now additional opioid-related addiction. People who are recreational drug users, cocaine, Xanax, meth, are now stumbling into the opioid crisis as well, and so we have to do everything that we can to make a difference. Our proposed framework is comprehensive, and we think addresses all of the angles that we need. It is also sufficiently flexible to allow for adaptation as we move forward, to allow for opportunities that arise, to allow for continued input over the course of the coming decades. It aims at its core to integrate our healthcare system, making treatment more readily available for people with opioid use disorder. This has been an ongoing effort for how we better integrate issues of addiction and mental health, certainly into overall healthcare. And I think by bridging people who have received non-fatal overdoses, the adoption of the Project Relay model from New York, people who go to our emergency rooms, and they are suffering and they have survived an overdose attempt, immediately infusing that with wraparound services by someone with lived experience to engage and talk to them at the moment of maximum vulnerability, but also perhaps maximum openness to a better path, is something that we know can be vital and can be helpful. But there's more we need to do in terms of integrating this into overall healthcare settings, and our traditional healthcare settings really embracing the nature of addiction and working, and we look forward to continuing those efforts. In this framework, we promote public health messaging for our youth. This aligns the dangers of opioid and substance use disorder, and I really appreciated our last board meeting, Supervisors Desmond, Lawson-Remer, and our District Attorney, Summer Steffen, for bringing forward a policy around how we can engage proactively with the younger generation and messaging that we know can help work. And this framework funds those efforts and that policy that was adopted by this board unanimously, and I appreciate my two colleagues and our district attorney for doing that. The framework also allows for expanding our harm reduction programs, expanding Narcan and training available for anyone who needs it, engaging with parents, families, and those who work with those most at risk for overdose, and enhance the social support and wraparound services needed to keep people on a path to recovery. Individuals who are suffering from addiction are not going to get better if they remain on the streets. And so the ability to get people not only the treatment they need, but the housing and the wraparound services and supports, I think, are vitally important. We also have some really creative and innovative ways around prevention, not just our public messaging campaign, but again, when you know that you're 20 times more likely to be on heroin if you started abusing a prescription drug that was not prescribed to you. And the reality is, while we have gotten better as a society and that the number of prescriptions are declining, our medical community is a little bit more aligned for being more restrictive in how many they give. There's more education and engagement with folks today. The reality is we have 20+ years of medicine cabinets that are stocked with unused opioids. We went through this in my own experience in my own household. After my wife's cancer surgery, her unused prescription opioids that were on the medicine cabinet had me do a deeper dive in our own medicine cabinet and realized that over time you tend to accumulate these. We also know that the majority of people, as I mentioned, on heroin arrived by there. We know so many kids are getting them from the accumulation and backlog that people have in their own homes. And so there are opportunities in front of it. And I always like, as a county, when we're a leader and we go first and we're innovative and we try something new. But in this case, a part of this plan includes using drug deactivation bags. We're a little late to the game on this. Many other places for decades have been using this as a very effective tool. Ohio, which saw some of the earliest, most severe impacts of the opioid crisis, started this a long time ago. They've monitored their progress, tracked their progress, saw that 30% of the folks were using them to clean out their medicine cabinets and dispose of opioids that they had. 99% of the folks talked about how easy it was to use the drug deactivation bag, a bag that any person can take and clean out any prescription, any legal or illegal drug in the bag. You add water, you throw it in the trash. 70% of the individuals in Ohio who were engaged in this program said that it was the first time they ever had to consciously think about cleaning out their medicine cabinet. And the presence of that bag is what motivated them to take action. West Virginia, who's been impacted incredibly hard, well documented the struggles, West Virginia has embraced this approach to try to remove the source. While we, just like we just did on homelessness, where we talked about the prevention and the people on the streets, you have to do both. I think we have to do both in this case. Both meet the need of people who are addicted today, along with taking action to lessen the potential impact down the road. Minnesota did an analysis of their drug deactivation program. 92% of post-surgical prescription drugs went unused in full. 60% of folks would just keep them in case they needed them in the future use. They weren't aware of the tremendous danger, of the danger that it posed to someone breaking in their home to steal them, of their kids. New York went a step further in requiring that any new opioid prescription be accompanied by a drug deactivation bag, along with specific instructions for how to get rid of those when you were done. University of Houston College of Pharmacy has done some incredible work. The Cherokee Nation in Oklahoma has seen incredibly positive results. And we have multiple peer-reviewed scientific studies that have been done and published in the Journal of American Medicine, both on pediatric cases where parents were engaged around prescriptions that were given to kids. In that case, they saw a 20% surge in proper disposal of unused prescription drugs. In the Michigan Medicated Intensity Board, and published in JAMA, tracked the results of drug deactivation bags and found they were 4 times more likely to properly dispose of opioids, again, getting to the source of removing that supply of things that can lead to addiction. And so our framework includes things that I think are vitally important, like this component as well. I believe we have to move as fast as we can to get all of these components up and running. We expect our first payment of funds will come in November, but that's only a total of about $4 million. And each year into the future, we will receive additional payments. But what we're proposing in our framework is to kickstart a substantial investment in meeting the need today to ensure that these programs begin, knowing that the funds will arrive, and as a county, we can replenish those. Included in here is immediate funding for our public health campaign, program administration, our drug disposal bags, our wraparound services, our emergency room engagement and visitation program, and our public education campaign is brought forward by my colleagues. The opioid crisis impacts us all in every zip code of this county. And I want to say a special thank you to Supervisor Joel Anderson for his work and his partnership. There's been a lot of work that's gone into getting us where we are today. But I think as a county, we can be very pleased that we're one of the first jurisdictions to adopt a comprehensive approach to tackling this issue related to the opioid settlement funds, and doing it proactively early has the opportunity to save lives. And so I appreciate everyone's support and work and efforts, and I look forward to hearing from the public and the board. But with that, I'll make a motion to adopt the recommendations in Agenda Item 20.